Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Now, as we know, we have seen almost all three classes regarding the cough and its approach in childhood clinical practice. In the last class, we were stopped with wheezing. Okay, now usually wheezing is one of the very common presentation in the childhood period, especially a 2-year-old kid, 3-year-old, 4-year-old, toddler or preschool age child. When start with wheezing, it quite obvious that parents are get worried because whenever there is a wheeze, the parents have got only one thing in their mind, that is whether my child is asthmatic. So now we need to clarify this particular doubt of the parents. And to understand this properly, we should know what actually wheeze is and how we have to differentiate different types of wheeze, and also how we have to differentiate wheeze of the asthma from wheeze of the other respiratory tract infections. Now, first of all, if you see, what do you mean by wheeze? Wheeze is nothing but a respiratory sound, but it is audible. It is also told that a audible rhonchi is called as wheeze. And we have seen that in the lower respiratory tract, when upper airways get involved, there will be wheeze. We have seen that upper respiratory tract. In the upper respiratory tract, if the uppermost areas are get involved, there will be a stridor. In the uppermost part, there is a monophasic stridor. In the lower upper respiratory tract, there is biphasic stridor. And in the lower respiratory tract, again, it is divided into upper and lower. That is, lower is again divided into larger bronchioles and smaller bronchioles. In the larger bronchioles, usually we will have the wheeze, and in the smaller bronchioles, we will usually have the breathlessness. This part we have seen by means of a very rough figure. So whenever there is a rhonchi is there, that is in the lower respiratory tract or some part of the upper respiratory tract, the bigger airways are get involved. Okay, so it suggests the obstruction to the upper airways, and such repeated attacks of the wheeze is always a matter of concern for the parents. And why this occurs? So for the understanding purpose, we can divide this childhood wheeze into three types. So basically they are divided in three groups. So first group is early transient wheezers. This is called as early transient wheezers. What do you mean by early transient wheezers? Usually they start from the infantile period itself. The wheezing will start from the infantile period itself, and the infants start wheezing in the early part of their life. The first episode comes almost all in 3 to 4 months of age. So what are the most common causes why the wheeze can occur so early? One of the most common problem is prematurity. Prematurity is the most common problem. Then if the child is having low birth weight, and if child has been kept in a ventilator for a long time, or child has been kept in the incubator for a long time, and if the child was given with positive pressure ventilation, see, these are some of the important causes when there will be early transient wheezers. The problems are many. There may be some sort of injury to the bronchial tree because of all the above conditions. In case of prematurity, the growth of the bronchial tree is not up to the mark, and ventilator stay and because of oxygen related toxicity problems may lead to bronchopulmonary dysplasia like conditions, and that may lead to this problem. And or babies kept in incubator, or positive pressure ventilation, because even the hazards of the positive pressure ventilation may also lead to this type of condition. And one more important thing is, even in a normal newborn also, there's a lot of difference between the respiratory tract of the normal newborn and an adult. Now when we talk about premature or low birth weight babies, definitely their bronchial tree is much immature, and that may be one of the cause for this early transient wheezing. So wheezing means there will be obstruction. Because of the obstruction, when the air is passing through it forcefully, then it leads to a sound. Okay, audible sound, that's called as wheeze. So this particular obstruction may be because of prematurity, maybe because of some ventilator stay or incubator like conditions, positive pressure ventilation, birth asphyxia at the time of, so this may be the condition. One more common cause is the bronchial, one more common cause for this early transient wheeze is cerebral palsy. In cerebral palsy, we know that there's a muscular problem most predominantly. Okay, spasticity will be there. There will be spasticity of the even the bronchial muscles also, and respiratory muscles, bronchial muscle, pharyngeal muscles also. So because of that particular contraction, the obstruction will be there. Okay, that is one it's basically a neuromuscular problem. So this problem is quite obvious. But in all these conditions, it may be premature baby, it may be ventilator stay or whatever it may be. As the child grows up, this problem will gradually get diminished. The reason is, as the child grows up, the airways will grow. The diameter, inner diameter of the respiratory bronchioles increases, the total diameter of the bronchial tree increases, then lungs, the ribs become more oblique rather than horizontal. So because of the development, as the development proceeds, growth proceeds, so these problems usually overcomes. Child overcomes all these problems. So this is called as early transient wheezer. So what is very important here is history. You take the history. When the mother comes with this particular history of wheezing in the 4th month, 5th month itself, look at cerebral palsy, look at other neuromuscular problems, look at prematurity, low birth weight baby, or sometimes IUGA, or some the hospital stay, ICU, NICU stay. So you have to inquire all about all these things. The only very important thing about this is, if you give the proper care, this problem will go into be diminished or overcome. Child will overcome this problem as the age advances. That itself will go to differentiate the early transient wheezer. Suppose a child is having transient wheeze in the early part of the life, but in the 4th or 5th month of the life, and later on 2 years onwards, no, the child is absolutely okay. So that suggests that that was a early transient wheezing. Okay, that was a early transient wheeze. Now, another type of the wheeze which commonly occur in the infantile period and the toddler period, preschool period, is atopic wheeze. Atopic means we know that atopic is related to allergy. Okay, so this incidence of such atopic wheeze is quite common at the 3 years of age. 3 years of age, toddler age, preschool age. Okay, so usually this happens when the child is get exposed outside to the community for the first time. Now, usually now there is a tendency that we will send the babies to kids to kindergartens, UKG, etc., play school, etc., by 3 years of age. Okay, now when the child is get exposed to outside, now there's a community. Now child is get exposed to so many infectious conditions. So it may be from within the school, within the community, anywhere. Okay, so child is get exposed to different types of viruses during this time. Okay, now one of the main problem with the child immunity at this particular age is child is not able to produce a required amount of cell-mediated immunity following a viral infection. Okay, following a viral infection, child is not able to produce required amount of the cell-mediated immunity. Therefore, there is every possibility that virus undergoes mutation, and mutated strain again can cause the infection to the child. Therefore, usually child will have repeated respiratory tract infection during this period. It's basically the T cell mediated immunity problem, quite common in most of the babies. Okay, so this is usually when this happens. So this may sometimes lead to respiratory tract infection along with the wheeze, because repeated respiratory tract infection, what actually happens, they damage the columnar epithelium of the bronchial tree. They will go to damage the columnar epithelium of the bronchial tree, and when the columnar epithelium loses its original configuration, and the mucus secretion will be less, and there will be drying effect, and because of all these things, the child is again more prone to viral infections. So during this time, child exposed to the different kinds of viruses. Now, previously, about 40 years back, the trend is, even 30 years back, the trend is, so we will used to admit the baby, or the admission to the school will be done by 6 years of age. Now it is 5 years. So usually the child goes to first standard in the 6 years of age. Now maybe it is 5 years. But in our time, that is 40 years back, there is no such problems, because child is get exposed to the external environment to a higher extent, larger extent, by the end of 6 years, or by 6 years, where the body immunity is completely almost developed. Now we are making the babies to get exposed to the external environment earlier. like sending the baby to the play school in the 3 years. So we have to face this problem because of this problem, because before complete development of the immunity of the child, we are exposing the baby to outside. So it is quite obvious that child is vulnerable to different types of infection. When such infections repeatedly occur, and there may be also presentation of the wheeze because of the epithelial cell damage. Now previously so this is one of the problem. Again, this also going to overcome in the later way, that it will get as the baby grows. Again, the same problem. Once the immunity get developed, this problem will not be there, this wheeze will not be there. Okay, so usually it is referred as hyper reactive airway disease also sometime. So this is called as atopic wheezers. This is called as atopic wheezers. There is some sort of allergy type things are there because of repeated respiratory infection. The mucosal membrane is get damaged, and because of this there will be wheezing. Okay. Now we come to the last one, that is Ide associated wheeze. Now this is actually one we have to be careful. Okay, so this is the real wheezers who are included under asthma group. Now first two should be differentiated. How to differentiate early transient wheezers and atopic wheezers? Because as the age advances, it will be get corrected, or the baby will going to improve. This is one of the important thing. Okay, now if it is Ide associated wheeze, then this is the real group of asthma group. Okay, these babies have got more chance of developing asthma in future. So usually we will find some of the family history, strong family history will be seen, or some other allergic history will be seen. Now how to pick them? Okay, so how to pick them? For example, a 2-year-old, when he is coming to you with a complaint of wheezing, it may be an early transient wheezer, it may be an atopic wheezer, or it may be an Ide associated wheezer. So now how you will going to differentiate? Ask one simple question, very simple, what I previously told, that is whether he is getting better with each attacks. Previously in the first year of the life, we used to take 6 to 7 attacks per year. Now in the second year, he has only got 2 or 3 attacks. In third year, now he has got only 1 attack. That means he is getting better with the age. So, okay, so if the answer is yes, he is getting better with the age, then either it may be early transient wheezer or it may be atopic wheezer. But if it is not getting corrected with the age and the incidents are same, frequency is same, then it is Ide associated wheeze. It is Ide associated wheeze. So Ide associated wheeze has got more tendency towards developing into bronchial asthma. Therefore, all the wheeze are not asthma. So we need to make it very clear to the parents that all the wheeze is not asthma. So we have to look into the history, to the past history and all those things, and we have to console them. Otherwise, it is quite difficult to convince them. So rightly what Ayurveda says is, Ayurveda also says the same thing. We have got 2 important topics like Shwasa and Kasa. Now Kasa Vega, there is 2 concepts in the Kasa. One is Kasa Vega and another one is Kasa Roga. Kasa Vega, he says Kasasya Roda Tadruddhi Shwaso Aruchir Damaya. Okay, that's the one thing. And what Vagbata says is Kasa itself leads to Shwasa Roga. So this is what Vagbata says. Okay, so it's an interface between Kasa and Shwasa. So that is what exactly the hyperreactive airway disease, which is explained in the contemporary medical science. Of course, that part we will discuss in the next class. So what best you can do by Ayurveda in this condition is a first condition where the early transient wheezers are there. So then you have to correct the general condition of the child. That's the best thing. Okay, so maintain the growth and development of the child, and helps to maintain the general condition of the child, and give some symptomatic treatment, mild symptomatic treatment. As the age advances, he will be get correct. Even in the even in the atopic wheezers also, we can go for the symptomatic treatment and improve the general condition, improve the immunity of the child. Okay, and take the hygiene of the child, go for the Nidana Parivarjana, etc. And this is Ide associated wheeze. This is typically belongs to asthma group. Now here you have to go some typical, very crucial Ayurvedic drugs, which helps to relieve the spasm of the bronchial muscles. Okay, we have got a lot of drugs. That portion we will discuss in other classes, in future classes, so related to Kasa and Shasa Ayurvedic portion. So these are the 3 important types of the wheeze that we have to differentiate in the early childhood part. Okay, So thank you very much. Please don't forget to subscribe my channel and also please give your valuable comments. Thank you very much. We will meet in one more class. Thank you.